Hello, welcome to the informational webinar for the Illinois Medical Respite Capacity Building Initiative. This webinar is about our request for applications for new planning awards. My name is Rachel Thomas. I'm a program manager with the Alliance for Health Equity here at the Illinois Public Health Institute. And today I'll be walking us through some details around the new request for applications for the IMR CBI Planning Awards. This is the agenda for the informational webinar. I'll start off with some background, including introductions for key players with this initiative, then some background and purpose for the award. I'll go through the award components and expectations, as well as priority areas, eligibility criteria, and then I'll give an update on the timeline, how to complete the application, and how to access our frequently asked questions. So the Illinois Medical Respite Capacity Building Initiative is a direct result of the Home Illinois Plan. It established the Interagency Task Force and Community Advisory Council in 2021, which includes 17 Illinois state departments and agencies, including the Illinois Department of Human Services, or IDHS, and over 100 processes, programs, and policies to develop a comprehensive plan to combat homelessness. The goal of the plan is to prevent shelter entry and, where unavoidable, ensure that shelter stays are limited and lead to quick transitions into stable living situations. Medical respite was identified as a key activity within the plan. In July of 2023, HB 2831 codified the task force into law, continuing their important work and ensuring their mission is protected by state law. Governor Pritzker's FY24 budget affirms this commitment, including this continued funding for the Illinois Medical Respite Capacity Building Initiative. The Illinois Public Health Institute is a nonprofit public health organization. As our mission states, IPHI mobilizes stakeholders, catalyzes partnerships, and leads action to improve public health systems to maximize health equity, and quality of life for people in communities. Since 2017, IPHI has been working at the intersection of housing, homelessness, and health, and has facilitated systems collaborations and systems development initiatives. This work led to our partnership with IDHS to develop this capacity building initiative. From March until June of 2023, IPHI awarded 11 Illinois communities with funding, technical assistance, and a learning collaborative led by the National Institute for Medical Respite Care. We are so proud of the work that our awardees accomplished, assessing the need for medical respite in their communities, establishing meaningful partnerships with stakeholders, engaging people with lived expertise in their planning, and developing plans for new or expanded medical respite services at their sites. And then in October of 2023, we entered the next phase of these capacity building awards, awarding 17 Illinois communities across the state with funding, as well as technical assistance and learning collaborative meetings for new planning, as well as pilot implementation of new medical respite programs, and then also expansion of existing medical respite programs. This new phase of capacity building awards builds on the last, advancing those plans toward implementation and expansion, and inviting new communities to participate as well. And then this new request for applications seeks to add additional awardees to our medical respite planning awards from February through June of this year. I just want to highlight our currently awarded organizations. To the right of the screen, you can see a map of where those organizations are located. But as you can see, we have 6 organizations who are awarded to plan for brand new medical respite services. In our track 2, we have 5 organizations that are implementing the medical respite program pilot. And then in our track 3, there are 6 existing medical respite programs who are hoping to expand their services at their site in some way. So congratulations to our currently awarded organizations. Next, I want to introduce our subject matter expert, the National Institute for Medical Respite Care. It is a special initiative of the National Healthcare for the Homeless Council. NIMARC is the first national institute to advance best practices, expert services, and state-of-the-field knowledge in medical respite care, which is also known as recuperative care. NIMARC is responsible for hosting our one-to-one technical assistance with the awardees, providing them key insights to advance their planning or pilot implementation of their site. They also lead our learning collaborative meetings, helping the awardees come together to learn and share best practices as well. So what is medical respite care? Medical respite care is acute and post-acute care for people experiencing homelessness who are too ill or frail to recover from an illness or injury on the streets or in a shelter. But at the same time, they do not require hospital-level care. So unlike respite for caregivers, medical respite is intended to be short-term residential care that allows individuals experiencing homelessness the opportunity to rest, recover, and heal in a safe environment while accessing medical care and other supportive services. Medical respite care is offered in a variety of settings, as well as in a variety of models. These settings could include freestanding facilities, homeless shelters, motels, and transitional housing. Here is some background information around this award. So IDHS has funded the Illinois Public Health Institute to develop this Illinois Medical Respite Capacity Building Initiative, including this continued funding for medical respite capacity building and technical assistance. This request for applications will support up to 3 Illinois communities with funding to build capacity for respite services in their community. This request for applications is a medical respite planning application, so it is exclusively for communities hoping to develop a plan for brand new medical respite services. This award will run from February 12, 2024 through June 30th, 2024. Each awarded organization will receive up to $25,000. And then the first payment will be 25% of that full award amount, and then the rest will be paid via cost reimbursement each month after that initial 25% is depleted. Because the award ends on June 30th, we expect that all invoices must be received by July 5th, 2024. This award will require that you submit periodic performance reports to update us on your progress toward deliverables associated with this award, as well as periodic financial reports in conjunction with the invoices that are submitted. We'll also expect a final summary report on all activities related to this award and a final financial report on all expenses. Each medical respite planning award recipient is expected to convene partners to assess the state of medical respite capacity in the communities they serve, develop a plan to increase local capacity for medical respite, including identifying successes, opportunities, and barriers to implementation, and the stakeholders and partners involved. They'll be expected to engage in at least 2 meetings of technical assistance and performance assessments with our partner in NIMARC. They'll also be expected to attend 2 virtual learning collaborative meetings on medical respite, also led by NIMARC. They'll also be expected to contribute to policy discussions related to opportunities for Medicaid coverage of medical respite care, and contribute to system collaboration building for medical respite care, either at the statewide level, in the Cook County level, or both, depending on location. They'll also be expected to engage people with lived expertise in their planning. In terms of the technical assistance and learning collaborative component, as I mentioned earlier, NIMARC will host 2 technical assistance sessions with each participant. Technical assistant sessions are intended to assist participants in achieving their project goals and provide tools and resources tailored to each participant's specific needs, challenges, and opportunities. Landmark will facilitate 2 learning collaborative sessions for the full cohort of participants. So that includes the 17 awarded organizations that were awarded back in October 2023. These learning collaborative sessions are intended to increase participant knowledge on best practices in medical respite care development and delivery, provide an opportunity for networking and peer learning across the state. And then each learning collaborative session will be structured to provide content to each specific award track. So those who join the cohort who are in the planning stage will join their colleagues who were funded starting in October, who are also in the planning stage. I also want to mention here that those organizations that are awarded in this phase will have access to view recordings from 3 additional learning collaborative meetings that were held prior to this specific award period. Now let's chat through some eligibility criteria. So organizations are considered eligible for this award if they have the capacity to execute the requirements of this project, including direct experience working with homeless populations, or a partner that has experience working with homeless populations, ability to convene relevant stakeholders and partners, the capacity to dedicate the staff time to manage this project, and the capacity to manage the funds and produce financial and program reports. Applicants will be selected based on the quality of their proposal, available funding, and ensuring other goals of the program, like diversity in geography and organizational types. Awardees are expected to engage people with lived expertise to inform their planning, and they should budget to provide compensation for their contributions. So when we go through the program budget, they should definitely include compensation for people with lived expertise in the consulting line of the budget. I will also note here that only one project will be funded in a single community or service area. In cases where we receive more than one application from a community that is selected, we may request that you partner with another applicant. I also want to note here that organizations that are currently being funded by the Illinois Medical Respite Capacity Building Initiative are not eligible for this funding. This funding is exclusively for organizations that are not current participants. I also want to highlight some priority areas that we are focusing on with this request for applications. Organizations that serve persons experiencing homelessness, organizations that have geographic reach in and or prioritize serving vulnerable communities, those that provide behavioral health or substance use services, as well as organizations that have a commitment to housing first and low barrier services are priority areas for us. Just to review the timeline, this application opens on January 10th. Applications close and are due at 11:59 p.m. CST on January 29th. The award will start on February 12th, and those who are chosen for this award can bill starting on that day or charge expenses to this award starting on February 12th. By February 29th, we are hoping to have our signed statements of work and subcontracts executed. And then we have our 2 learning collaborative meetings, the first in April, the second in May. And then we will have the end of the award period on June 30th, which is also when the final reports are due. And then July 5th, the final invoices and final financial report is due. Okay. Submission overview. What materials should be submitted? So all complete applications will include the completed application questions, which do not need to be completed directly in the application document. You can complete them in a separate document, but make sure you answer all of the questions. It will also include a completed project budget. There is a format included within the request for applications. We request that you use that format to complete your project budget. as well as letters of commitment from a member of your senior leadership team and any relevant project partners. Your application should be submitted via email to me, Rachel Thomas, at iphionline.org. Please use the subject line Medical Respite RFA. And then again, the deadline to submit this application is January 29th, 2024 at 11:59 p.m. CST. I just want to review a bit of what the medical respite planning application questions consist of. So again, this application is intended for organizations that do not yet have an existing medical respite program, but who want to build capacity for one in their community. Applicants are encouraged to apply in collaboration with one or more community partners who will support their project. Applicants in this track will be asked to describe the need for medical respite in their community, their organization's initial ideas for building capacity, and then those strengths and barriers to building capacity for medical respite in their community that they've observed so far. The maximum budget for this project is $25,000. Allowable costs include salaries, fringe, consultants or contractors, supplies, travel, occupancy, printing, communications, training, meeting costs, other costs, and indirect costs. Budgets must include compensation for people with lived expertise, and we request that you log that compensation in the consulting or contracting line. I also want to note that equipment purchases over $5,000 will require additional approval. Capital expenditures are not allowed, so that consists of, purchasing any property, whether that be a building or a vehicle. Those expenses are not allowed. And then again, anything over $5,000 would need special approval and is generally not allowed. All right, so we have compiled a list of frequently asked questions that we have received over the past 2 requests for applications that we've released. We've compiled them into a document, which you can access via our website or on the link here in the slides, which will also be provided. If you have a question that is not listed within this FAQ document, feel free to email me directly at rachel.thomas@iphionline.org with any additional questions. Please use the subject line Medical Respite RFA question. All right, and that concludes our informational webinar. Please visit our website or email us for more information. Our website is listed on the screen and will be linked in these slides. And feel free again to email me or access the FAQ with any additional questions. Thank you for your time, and we look forward to reviewing your application. Thank you.